Hello, Overcomers, and welcome to this episode of Connect Over Coffee. I'm Runsi, the founder of Ovarcom, and today we are joined by two very special and fascinating guests, Dr. Walther-Antonio and Dr. Asangba. So Dr. Marina Walther-Antonio is assistant professor in the Department of Surgery and in the Mayo Clinic Center for Individualized Medicine Microbiome program. Her research focuses on the role of the human microbiome in women's health. With her today, we have Dr. Abigail Asangba, a microbiome researcher also at the Center for Individualized Medicine at Mayo Clinic. And together, they are involved in some revolutionary and potentially practice-changing work in diagnosis, prognosis, and recurrence of ovarian cancer. So we have a lot to learn as we chat with them today about gut health, overall well-being, and ovarian cancer. So grab your favorite coffee. I have mine, and join us as we talk to Dr. Walther-Antonio and Dr. Asangba about everything gut microbiomes and overall health, as well as ovarian cancer. And if you have any questions as we go along, please type in the comment sections below, and we will get it addressed post the discussion. And as I always say, please share this information far and wide with anyone who may benefit from all these tremendous insights they're about to share with us. So with that, a huge welcome to you, Dr. Walther-Antonio and Dr. Asangba, to this episode of Connect Over Coffee. Such an honor to have you both with us.
Thank you for having us. Really happy to be here.
Thank you. So I have several questions for both of you. And before we get into the details of what we are talking about today, could you very briefly tell us about, just gut microbiome? What is it and what should we know about it?
So the gut microbiome is kind of where the human microbiome field started focusing on, looking at microbes not just as enemies or pathogens or germs, but also thinking of microbes as something that can be beneficial to our health. And in fact, that is a very important part of our life and performs functions that we actually need. So it's kind of that idea that, some people talk about that dirt isn't all bad, right? It just depends what kind of dirt we're talking about, because there's some exposures that are actually very beneficial to your health. And so the kind of research that we do within the microbiome is to try to understand what's the difference between those microbes that can harm you versus those that protect you and that you should foster. And also understanding that there's some who are opportunistic in the sense that they will be good for you up to a certain point where you might become sick, your immune system might be debilitated for some reason, and they may take advantage of that and actually become adversarial at that point in time. So we are interested in understanding those switches and how can we prevent that from happening, and what triggers the microbes to go into that state of going from friends to foes, so to speak.
Wonderful introduction. Thank you. And so I have a follow-up question for you. You have been quoted as saying that if the solution to a medical problem does not nearly or neatly fit into a particular expertise, then it is time to bring in interdisciplinary thinking. So tell us more about the groundbreaking work you do with the particular emphasis on ovarian cancer.
So my background is very unusual in the sense that I was trained outside of the medical field. I was trained as an astrobiologist, which means I was most of my career I was looking at understanding life on Earth in general and microbes in particular, and trying to find life elsewhere, missions to Mars and that sort of thing. So quite a very interdisciplinary field that includes, geologists, biologists, chemists, even philosophers, and everything in between. And I was recruited to Mayo to really help bring this new emerging field at the time, the human microbiome field, and the expertise that we have in astrobiology was close to that, and we could bring some of the technologies, some of the concepts into the medical field and try to study microbes in our body from a different perspective than the standard clinical microbiology, which is more of a pathogen type of inquiry, right? So, I always have a holistic view of things. I'm a big fan, and Abby's going to laugh at this, but, I'm a big fan of Einstein. I keep saying this, right? That as Einstein said, things should be made as simple as possible, but not simpler. And so it's very important to me that we don't miss something, because my biggest fear is that we are studying something and we just notice that we forgot something that could be important to it, and maybe the answer was there, and we'll never find it if we excluded the one thing that needed to be there. So I always like to start with a very holistic and then eliminate as we go through, as we are sure that that's really not part of the story. So I think, there's been a lot of focus recently in the human genome and, our genes and what they do, and immune system and everything. I think the microbiome is one such component that cannot be dismissed before it's investigated. And so this was part of our goal here, was to, because we've had work showing that in endometrial cancer, the microbiome does seem to indicate the presence of the cancer. We thought, it was actually Scott Kaufman, who is the director of the Mayo Clinic Ovarian Sport here, that was at one of my talks, and said, you absolutely need to do this for ovarian cancer, because if you find something there, that could be such a game changer type of finding. And so that's what kind of motivated us to look into ovarian cancer and see if the microbiome might be a part of the story. And if it is, we really need to understand it and take it into account for a variety of reasons that I'm sure we'll talk about as we move on to our conversation. But that could span from prevention to treatment, really.
That's fascinating. And yes, we will get into details about that for sure. So just generally speaking, though, if you were to give us a very brief highlight on, and this could be either of you, in terms of how gut microbiome impacts the brain and overall health, what would you share with us on that?
So this is something we didn't investigate in this particular study, the last ovarian cancer study, but we have looked into some of that. The there's gut brain axis, what's called the gut brain axis, where microbes in our gut can produce what's called metabolites. They're really chemical compounds that they produce as part of their living, and that can transfer into our bloodstream. And then impact hormonal cycle, for example, for women, or even adrenaline kind of receptors that can influence a lot of our even depression, well-being, inflammatory systems, and it can really have a systemic effect that can be widespread into our function in general, and also brain functions. There's been lots of studies done on things like autism, even Alzheimer's, and as some potential impacts there. These are all, I would say, the microbiome field is relatively new still, and so there's still a lot to for us to understand. Why certain things seem to associate or correlate, and if that's just something that is there but without a functional meaning, or whether there is actually something that we can do to actually change that from happening or modify it. And that's, a lot of the studies are starting to move into what's called the mechanistic stage, which is going from those associations to, okay, it's a biomarker maybe for the disease, but can we actually do, is this actually doing something to us that is meaningful and that we can modify in a way that is beneficial to patients, right?
Okay, and so in terms of our overcomers, ovarian cancer survivors, they also may have some comorbidities, right? Like autoimmune diseases, obesity, and certain other metabolic conditions, which seem to happen because of the imbalance in the microbiome system within our body. So, briefly, can you talk to us about why does this imbalance cause these kinds of autoimmune or other kinds of diseases, and is there a way to kind of interject and stop it before it actually happens?
I hope so. I guess is the answer I have to that, but it's too early for us to really know the answer to that question. We know that microbes, they can have pro-inflammatory or anti-inflammatory properties. And so they can certainly contribute to what we experience, even how we metabolize, how we digest food, how we metabolize it, how we break it into components, even drugs that we take, medicine. It can impact dosages that that are prescribed to us, and so and can modify those drugs as well. So there's a really large span of things the microbes can do that we know impacts our health. The question is, we need to understand it well enough to be able to intervene in a way that it's going to be beneficial. And it's not an easy task because of the complexity. It's not just one microbe, right? The microbiome is a community of microbes. Every time we do an intervention, say an antibiotic or something, it's not just going to impact this one microbe. It's going to impact the whole community, and that can modify it in ways that are not entirely, beneficial. Some of them might do other things than what we wanted to do. And so that's why it takes some time to kind of understand how we can do this best. And there's some new technologies and techniques that that are being introduced to think about more specific ways to target microbes that are specifically less broad, like antibiotics. But it's still very much a work in progress, and something that will continue to be investigated.
Wonderful. So in terms of the relation between cancer and microbiomes, what would you share with us on that?
So there's a lot of things published at this point, I think, about cancer and microbiome. It's a field that has exploded in the last years. There's been study, we've published in endometrial cancer, we've now published in ovarian. There's other groups published pancreatic cancer, skin cancer, all over the place. There are some microbes that are emerging as kind of associated with several types of cancers, which starts to be very interesting to pursue, as in terms of generally, maybe these microbes just aren't very good for us in general. But what we also see is that it depends on context a lot, unfortunately, and that's kind of where the complicating factors come in. Sometimes we see certain microbes associated with some cancer, and other patients associated with the absence of some other cancer, right? And so that's when it becomes complicated. We, of course, being in the Center for Individualized Medicine, think that every person is a person, and so a microbe that might be beneficial to me might be harmful to you, and vice versa. And to understand that, we need to understand the complexity of each patient, and in the context of the rest of the microbes that are there, the rest of the communities, what you eat, what you level of physical activity, comorbidities, that can really change the whole interaction. Microbes, we don't typically, I think most people don't typically think about them in this way, but microbes are also social. And so they will behave and adopt different functions depending on circumstances and who else is there. And so that's the part that we need to kind of take into account when we do our studies, and basically even put microbes with our cells or human cells, but also with each other, and see if they change. And they do. Often, depending on who else is there, they will adopt more beneficial or detrimental functions. And so that's where we need to be cautious with sometimes some of the conclusions.
Okay. And so you are doing some work on microbiome, just staying on this microbiome signatures that may lead to early detection tests for ovarian cancer and endometrial cancer. So that is huge because, as you know, there still isn't a reliable screening mechanism for ovarian cancer. So this could be life-changing for a lot of people in our community, right? So tell us a little more about this intervention work that you're doing in your work in your lab, and how do you see this progressing?
Sure, I'll just briefly, and then I'll pass it on to Abby too. But this is still very far from being a clinical test or being available to patients. Unfortunately, these things take a long time, as I said, and I know it's very frustrating. It's frustrating to us too. But it's in the best interest of the patients to really make sure that where our findings are are real, and that they're not going to hurt anybody. So what we're seeing is that we can in our study, what we basically investigated is that we saw the presence of certain microbes in the vagina and also in the reproductive tract are associated with patients with ovarian cancer. even more so with early stage ovarian cancer, which is, the most difficult one to and most important one to detect, right? So that provides a great sense of potential to the finding that this could be used for something like that. But again, this was a study we had 64 patients total, and so, it's still a small cohort, and so we need to kind of do this in larger cohorts of patients to try to understand if that finding holds true in different populations. And if so, we can do different things. Then after that, we can target those microbes, in particular a test that is, instead of just seeing all the microbes you have, just do you have this particular combination of microbes or this particular microbe, and then if you do, then maybe maybe should be looked closer right into if there's something to be worried about or not at that point in time. But again, this is kind of the first study of pilot discovery stage still, that there's a long way to go to do something like that, I would say. But Abby, I'll let you also.
Just one question on this, because you said you had 64 patients in this study, right?
Yeah.
So we talked briefly about how our signatures can be uniquely different from one another. So just a curious question on these 64 patients, maybe Abigail, you can answer this for me. Were they similar in their signatures, or were they all uniquely different? I mean, can you tell us a little more about the profile?
Yeah, so on a personal level, definitely we see differences between patients. But what we do is we usually will group them based on a commonality. So if you're looking at, so basically we had 64 patients, 30 of them we would call the control group. These are patients that did not have ovarian cancer, but they had to undergo hysterectomy for other benign gynecological conditions. So technically they were not really a healthy kind of group anyways. And then the other 34 were patients with ovarian cancer. So we had different groups that would put them into. We could look at patients in early stage, late stage, low grade, or high grade, different histologies of ovarian cancer. But definitely at the lower level, individual level, you still see differences, individual unique signatures from each patient. Yeah.
Yeah, and I would add the commonality between them is that we took patients that were treatment naive. So the first surgery that they had, that's while the patients were in this particular circumstance. But the profile of them is kind of similar to what you typically see in ovarian cancer, with a majority of them being late stage and serous type of histology and that sort of profile. We wanted to capture a population that hadn't been treated yet, just so we avoid confounders linked to just the types of treatments they received and their response and that sort of thing. So,
okay. So you're running some clinical trials, it seems, on the microbiome impact in ovarian cancer, the return of ovarian cancer recurrence, as we say. So can you tell us about this? And, because, majority, as you said, majority of the ovarian cancer patients get diagnosed at an advanced stage, but not only that, their cancer almost always recurs, right? So we always are more interested about, to learn more about recurrent ovarian cancers in that setting. So tell us about the clinical trials that you're running in this space, and what should our overcomers know about this trial, and how could they sign up if they're interested?
Yeah, so just to clarify, so this particular study that we published now, it was not a clinical trial in the sense that we're not testing things in patients. What we did though, and this wasn't quite planned at the time, to be honest, but we just wanted to look at, could we identify microbes associated with the disease or not, and that was kind of the initial goal. But then we thought, precisely exactly what you said, that well, there's really a big interest in recurrence, and could we predict whether patients are going to do well or not? And so what we did was we followed up these patients for 2 years and then 4 years, and saw how they were doing. Were they responding to treatment? Were they not? And so we looked at the microbiome markers and said, could we have predicted their response at that time when we did that collection? Could we have seen that this patient is going to not do well in 2 years or in 4? And what we found was that we could actually, with the microbiome markers, were enough to give us a prediction of how well these patients were going to do later on. You know, and complicating factor here, of course, is that unfortunately, as it stands right now in ovarian cancer, there isn't like, you know, a lot of options for treatment. And so, you know, the fact that we can tell their patient might not be doing very well in the future might not actually change anything right now, because, you know, there's just not many alternatives. But it provides some potential for that if other treatments, you know, appear for example, for patients choosing to enter clinical trials potentially, if we have, you know, if this evidence is corroborated that indeed we can see this patient is probably not going to respond very well, for example, you know, might be a conversation to have with patients in the future to think about alternative options. So, but right now, as it is, it's just you know, not very actionable given the what we can do for these patients.
But to your point, I mean, this is significant information. If you can accurately predict that this set of, you know, patients are not going to do so well in terms of treatment, you know, that their cancer is going to return regardless, or they're not going to, you know, to me as a patient, that would be information I would like to have, because then I have options to decide what I want to do going forward, in the sense that, do I want to introduce more toxicity into my body with more further treatments which are going to be of no use or very little use? And I feel like this information could help, even with limited treatments these days. It could potentially help the providers to have that conversation with the patient community as to, you know, like you said, it's not definitive, but it's something that we are not sharing with our patients at this point in time. So this is absolutely groundbreaking work. So congratulations again for this, because I feel like we could empower our community so much with all of this information, not just what to do with their treatment pattern, but also just in terms of how to improve their overall gut microbiome, overall health and well-being, to respond better to treatment. So it's holistic, in my opinion. So, Abigail, this is a question for you. Again, this is, you said in one of your papers or interviews that you found a clear pattern that reveals women with early stage ovarian cancer, they have a significantly higher accumulation of the microbes when compared to women with later stage disease. So, tell us a little more about this finding, and what should our overcomers know and be aware of?
Right. So basically, Marina has already talked about, we talked about the correlation between between cancers and ovarian and the microbiome, right? So when I think about this, or where we are trying to get to, the gold standard obviously is something like you go and get a pap smear and then look for HPV, which would be indicative of cervical cancer, right? So that would be the gold standard if we're able to get there, whether it's a specific microbe that, if it is present or maybe absent, could indicate that you could be at risk, or you already have the specific cancer. So basically, and we already know the ovarian cancer, the biggest issue is the inability to screen and detect it early, right? If we could get early detection, we'll be so much better off. Then you can have more options. So what we did was to look at patients, and as you know, because most of the patients that come through would have already been late stage patients, we didn't have a whole lot of early stage. But what we clearly found was that there is this accumulation of microbes that we deem pathogenic, or what you would think, what would you say, that are not friendly microbes, right? And these were accumulated in the early stage patients. And what we see happening is that actually first step is when you do a comparison between what we call the control group and the ovarian cancer patients, you see a general accumulation of these not favorable or pathogenic microbes in the ovarian cancer patients. So there's a general accumulation in that. And when you go a little further in details, it's when you realize that the accumulation actually happens a lot in the early stage. And as the patients advance in disease, the stage advances, it actually goes down. So this gives us a really nice small window of opportunity, which is great if you're able to catch it on time, right? We know that the pathogenic microbes are there generally in the ovarian cancer patients, but it's highly accumulated in the early stages. So this would be the what would we look for, right? So if we can be able to get that accumulation before they transition. So unfortunately, it's not just one microbe like what we have with endometrial cancer. Marina has already talked about that, where we can actually associate one specific microbe's presence. So that's where we are right now. We have a whole bunch of microbes that we know are pathogenic, that are highly accumulated in early stage, but they tend to go away with advanced stage. So this opens up a small window of opportunity for us to be able to pursue further. And as Marina mentioned, if you're able to confirm this result in a larger cohort, then we can be able to move forward in that direction.
That is so promising. And so I know that this is all like work in progress and development, but once you have this information, right, that what you talked about, how would you potentially intervene here to that small window? What would you actually do to help these patients not move into the later stage cancer?
Yeah. I guess I'll take a little bit part of it, and hopefully Marina would take the other part. So one of the things that we talked about, because right now we don't even know exactly when the transition happens, right? So one of the first steps, or one of the first thing we need to do, is to do a longitudinal kind of study and sample from those women if we have early stage ovarian cancer patients, or before they even develop, which would be the greatest one, is to have multiple sampling points and to see exactly when this transition happens. And what we can do, whether it's something, if obviously, so another thing to mention is these microbes, like I said, are pathogenic. And the reason we know they are pathogenic is because they've been found in in different conditions, other kind of cancers or UTIs or other illnesses. So we already know about them. So if we can intervene, if we can prevent, whether we need to just decrease. So Marina mentioned something about how microbes take advantage, right? So one of the very classic examples that I usually give people is Clostridium or difficile. This microbe is found in the gut. Normally, it's at very low abundance, and it doesn't do anything until you get antibiotics or other kind of treatments that wipe away and your native microbiome gets wiped off, and then it takes over. And then that's when it becomes problematic, right? So these microbes could be present natively, not doing much because they are in low abundance. And then what microbes you need in your reproductive tract that protect you, if they get wiped away due to whether it's a disease condition or some other reason, then they take over. So that's what we need to find out, right? That's what we need to find out, what causes them to accumulate and how do we prevent that from actually happening. So Marina can add more.
Yeah, I mean, just to go directly to your question, which is a great one. You know, it's very challenging because ovarian cancer doesn't have risk factors really identified, and so identifying the population that you would do this to is difficult. So Pap smears, for example, you know, are introduced to all women. All right, and everybody does it, and you know, ovarian cancer. Fortunately, is not as common of a type of cancer for women to develop. So there's the question, you know, we have to balance between, you know, wanting obviously to catch patients with early ovarian cancer because their prognosis is going to be much better, and putting all women or, you know, through something like that as screening for ovarian cancer, which, you know, it's costly from a medical care perspective, and it causes anxiety and all kinds of things, right, that people have to go through. Screening for breast cancer, for example, is justified as well because of the prevalence of cancer. So ovarian is a difficult situation and has been very difficult to manage clinically because of this. Because it's you know, you have to balance the, you know, we have, I think in 2022, there was close to 20,000 new cases of ovarian cancer. No, 70% of them are late stage. You know, you have to think about what can we do besides, you know, screening the whole population for something that is not going to be that common to catch, fortunately. But understanding that can be life-saving for those few women that would be able to catch. and this is a decision that, it's done with clinicians, with patients and everybody involved to think about the pros and cons of something like this. How strong, it depends a lot on how well the test performs too. How specific is it if the microbe, for example, as Abby was mentioning, can be present. This is, for example, the story of Helicobacter pylori, right, which is the microbe associated with stomach cancer. This one, for example, 50% of us have it. And, we don't have stomach cancer, most of us, right? But what happens is that from the patients who do develop stomach cancer, 90% of them have it. So you're in a situation where, just testing for it overall isn't really helpful. But we do know it does increase your risk to cancer. And so it's something to pay attention to. One of the things that we're kind of strong on, again, being an individualized medicine field as well, is to empower the patient to make their own decisions if they can. And so, providing potentially these kinds of tests that could be, acquired at Walgreens or whatever, some kind of that people could access if they want to do it. It's an option. But again, it is complicated. It's a very complicated question because of the epidemiology of the cancer.
And, I was just thinking as you were speaking that, yes, I mean, population-wide testing is probably not the answer at this point in time, because it may just create more problems than it will solve. But,
right.
For situations like in my case, okay, my mom passed away from ovarian cancer. So I have very strong family history, yet I am BRCA negative, right? So the doctors would always tell me that, or the healthcare team that I have, that, okay, there's no need for any surveillance in your case because you're already BRCA negative. Again, however, we know that I have personally spoken to patients who did not carry the mutation, but they had family history, but they developed ovarian cancer a few years later. So there is no answer to this, right? How did that happen if there is no genetic mutation, but there is family history? So in cases like mine, for example, I mean, checking my microbiome health every week, or people like us, could be something to start with. And if we see some colonization that you were talking about and some, activity that is abnormal, then there is this opportunity to catch the cancer early. So, I mean, lots of avenues, right? So
that's a great idea, actually. I think your case is spot on something that could definitely have an application for obviously it is a risk factor if you have someone in your family that has developed the disease. Being BRCA negative is great. But yeah, I think for those patients that would like to still try to understand whether they are still at risk despite the negative genetic test, and if the microbiome can fill that gap, that would be amazing. I think that could be
exactly. Exactly. I was thinking about that as you were speaking, that I can see an application right here. I mean, individualized to people like us who have family history but do not carry the mutation, but we still want to know and be on top of, any symptoms to come or any disease to come, because we have that strong link to ovarian cancer. So
this is why patient advocates are so important to these discussions. I mean, I seriously, yeah. This is a great idea.
Thank you. So Abby, you may have, and pardon my knowledge on this, but you may have talked about this already. But you were talking about the activity that patients have at the early stage of on their microbiomes, that is kind of different and separate from later stage. So I was reading about this colonization of disease-causing bacteria. So is it the one and the same thing, or is it different? And I mean, does this colonization look similar in all patients with ovarian cancer, or their individual uniqueness that we need to talk about? Or have we already covered this?
Whether the bacterial signal is the same across the patients, is that what you're?
Yeah, that's what I'm asking. Yeah.
Statistically similar, yeah.
I would say that.
So yeah, every single individual is going to have an individual profile that is fairly unique for that point in time. It also changes through time, so that's another complication thing we need to deal with. But which is why longitudinal studies are important. But then, the types of tests that Abby run and is to, determine whether there's statistical significance, right? Whether there are particular microbial signatures that are common across all the patients with cancer that are not present in patients without cancer. And that's when you kind of highlight that those microbes, are always there when there's trouble and are rarely there when there isn't. And so that becomes kind of a pattern that we identify as unique to that group of patients. Yeah.
So thank you for that. So generally, when I'm reading about, gut health and overall health, there's always this suggestions on adding more fiber, more fermented foods into your diet to be able to, improve our overall gut health. So do you have any guidance on this that you could share with our overcomers? Because I feel like, this is something that we all can do. It's not just when you're diagnosed with a type of disease, but we can all collectively work together to kind of improve our gut health. So what is the role of fermented foods or fiber, if you could shed some light on that?
So again, it seems to be a little individual, in talking with patients and some research studies that have been done. Some patients benefit from those, some patients don't benefit. And so what, a typical, clinicians tend to say is try it. And if it works for you, that's great. Keep doing it. If it doesn't work, stop it and do something else. And it's kind of a trial and error because we don't quite understand why is it that some people, and there's ongoing studies and we gain more knowledge as we go. But right now, there's no definitive knowledge on knowing whether that's going to be helpful or not. For ovarian cancer in particular, one thing that we see is that a lot of the patients are actually healthy. Otherwise, right? They're even athletes. They're young. They're healthy. They do everything. That to have good health and be in good status, and despite that, they develop this terrible disease. So it's difficult to say what could they have done better. It's really I can't think of anything. Most of the patients I look into their profile, it's like I don't. No, it's very frustrating for them and us. And that's why we kind of want to try to help, maybe the microbiome is a contributor to that. And that was kind of our idea to try to incorporate that also into what's already known. And maybe that's a factor that we can modify and contribute. And maybe some probiotics, it could be, vaginal probiotics or gut microbiome, gut probiotics or prebiotics. There's also prebiotics, which are the food for the microbes, not for us, but feeds the microbes that we are interested in retaining. And there's a phage therapies now also as options. So there's several interventional options that could be tried. If we do see that the microbes are relevant to the disease, there's several tools we can utilize to try to modify it in the right way, which could be what you just described, or it could be something else. But it's something to certainly investigate.
So what I heard you say is that there is no harm in trying it, because in certain situations, in certain patients, they can be more effective than the others. But there is, in general, no harm to trying to improve your overall gut health with more fiber and more fermented foods and prebiotics, as you mentioned. That's also important. So my question was, because we get a lot of questions from our overcomers on supplements, right, while they're going through treatment. And there's always this debate on what supplement is actually good for you versus what the supplements you may want to avoid while going through treatment for ovarian cancer. And there never seems to be a definitive answer. I think, to your point, it just goes back to what the patient is responding to. That defines what works for him or her.
Yeah, I would just add something to that. So, if you're feeling well, and it can take you out of that state or that balance. So, kind of what you typically say, don't try to fix what's not broken, right? So if you're feeling fine, you're probably fine. But if you're experiencing issues, and I know a lot of the treatments, they cause a very severe, in fact, sometimes gut symptoms, and that can actually interfere with the treatment and stop it altogether because they're very, very debilitating. What I would say is, talk to your physician. What's really important is that the clinical team, whoever is taking care of the patient, knows what you're doing. There are some compounds, and there are some of those, even over the counter products that can potentially interfere with the treatments you're receiving from your doctor. So, it's not a question of, can you not do it? I think they need to know. It helps them understand what they're dealing with and what else might interfere with what they're trying to do. Some of them can have an impact on your immune system, for example. It depends on the product. And so that can become very relevant for the doctors, one, to try to help you, and to also understand, if you're one of those big, success cases that, somehow managed to defy all odds and do very well with the treatment when the expectation was very poor, that becomes a very interesting, you become a very interesting, valuable person to study from a clinical perspective, because we want to replicate that, right? We want to make sure that whatever it is that you did worked so well, we would want to understand why. And so that can also help other people. So I would really encourage people to talk to their physicians about what else they're doing, so that we can know, and we can study these things, because they can lead to very, very, very big breakthroughs for many people.
Absolutely. And to your point,
sorry, I just wanted to add a quick thing. Marina's already said those before, and coming from the Center for Individualized Medicine, one thing that is becoming clearer is the fact that it's not one size fits all. Marina already mentioned it. It's your person as a whole, from your genetics, your microbiome, to your lifestyle choices. So what might work for patient A might not work for patient B. So definitely getting all your answers and working with your physician or whoever is involved. Definitely. So you can't say because one patient is doing well on this supplement, that might work for you. Could be a completely different case for you.
Absolutely. And that is where we need to progress on this individualized, therapies, not just for cancer, for everything, right? And, I asked this question in one of my interviews with another doctor, is like the role of AI, right? It's going to be huge. I mean, it is already huge, but I see that, AI can intervene in such ways to transform the way we offer medical care these days, and into the future. So it's lots of promising breakthroughs to come, it seems, which make us excited. So you'd already talked about talking to your doctors and your healthcare teams when you're going through treatment about these supplements, and just sharing information so that we can have a better process in learning and understanding. So in general, though, if anyone wants to test their gut health, cancer or no cancer, right? Are there any specific tests that need to be ordered? Because I know from my personal experience, my doctors, they never talk to me about this. So then, for someone newly diagnosed, or someone even going through recurrence, or whatever the stage of ovarian cancer, or like I said, even like the general population, if we are interested to learn more about our microbiomes and our health and our signatures, are there tests that we could potentially advocate for ourselves to order with our physicians?
Yeah, so the reason why clinicians aren't advising to do those things right now, or it's because it's not a clinical test, right? So because it's in a research realm, we're not quite sure what it means yet. So there's actually many companies that offer such tests, and that people can do for their own understanding and their own information. And it's something that, if you want, you can share with your doctor if they want to look into that with you. But again, it's research. There's no clinical action that can be really driven by it right now. And again, that's why we do these studies and have clinical trials and all these things, to try to know whether we can do an intervention that is safe and that is helpful, right? That's the two things that we need to make sure. First, safety, and second, that it's helpful and it's not wasteful. So, but for your own information, I mean, it's like right, people do 23andMe and that sort of thing. Like they want to know about their, information is not necessarily something actionable right away, but it can become in the future, right? So that's always, again, for our purposes and from a research perspective, that's great for us as accumulated knowledge that we get to know about people, especially there's some patients that are very committed to this and will do the repeated sampling through time. Like when they feel good, when they feel bad, after they recover, that information from a research perspective is extremely valuable for us to understand, like, and see how you look like when you're healthy, how you look like when you get sick, and how you look like when you recover versus when you don't. That can be extremely valuable information for us to have, and then utilize it to really develop potential clinical tests out of it. So, I again, not something clinically actionable for the most part right now, but might become, and because of those sorts of things.
Yeah, and the thing is, one step at a time, right? I mean, but this has so much promise to offer. I feel like we all should know more about our gut health, cancer or no cancer, because it could have some potentially groundbreaking, changes to bring. So generally, though, I mean, I know this is a strong question, for the lack of a better word, but just improving gut health. And this is not, I mean, I've heard from many functional medicine doctors too, that gut health is the end all and be all of everything. And it can actually repair, it can restore, it can even reverse diseases, and not just cancer, but generally, like, all autoimmune conditions and such. I've read a few books on that. So how far is this true? I mean, like, can improving gut health actually reverse disease, or you can go into remission forever? I mean, I know this is all in research setting, all in the learning phase, but any thoughts that you could share with us would be appreciated.
Yeah, again, I mean, early on to know. I know there's a lot of research studies though in that direction to try to understand that and give an answer to those questions. We all tend to, when we have these discoveries and kind of, and there's a few other groups that make great discoveries, you think of the Holy Grail, and this is going to be like eternal life for everybody, and solve all the world problems. It's often not the case, unfortunately, right? But it might solve the problems of a lot of people, and very significant ones. So, and it's worth pursuing and seeing what we can do with it and how far we can apply it to patients. But the biggest fear, I think, that's why researchers tend to be very cautious, is because we are very afraid of hurting people, right? Or of conclusions, maybe not, ending up not really holding up to other, follow-up studies and replications of studies, and then it could cause harm to patients or false hope and that sort of thing. It's not good, right? So we want to be cautious with what our findings are telling us, and move as fast as we can, but still always keeping that thing in mind, that patients are on the other end, and that we do receive on occasion emails from patients directly and that sort of thing, and it's always very rewarding to receive those emails and try to help them, but we feel a great sense of responsibility to not give false leads or false hopes to people either, because they have the right to also know what the truth is, and how close we are to these things. It's still a ways to go, right? Most discoveries in medicine, from pilots to being available to patients, if everything goes right, it takes about 10 years on average, right, for that to happen. And that's if everything goes right, which is usually not the case. So a lot of things we have to redo that looks different. Maybe in this population doesn't work this way, and then you have to test in different ways, and then taste safety. Maybe that doesn't pass the safety. Maybe it is useful for some people, but it's very dangerous for others. So again, we have to weigh all of that before giving that to patients, which is a big responsibility too.
Yeah, and like
To
you said,
add a quick thing, sorry. Just wanted to add that also, like Marina mentioned, most of the studies that we see, and you probably, if you read microbiome papers and with diseases of any kind, mostly what you see them use is the word this association, right? So there is an association between specific microbes and the specific disease. But one of the biggest problems right now is even trying to figure out, did this disease condition result in the microbiome signatures you're seeing? Or did those microbiome signatures actually led to that disease, right? So you need to figure that out first. I know now we are moving to the area where, or times where people are actually looking at the mechanistics of how these things happen, how exactly, like we are trying to understand better how the microbe that we are interested in when it comes to endometrial cancer, how it might actually be doing what we think is doing, right? So people are getting there. But until you're able to figure these things out, you can't just say just because you see this microbe and is always there when the specific disease is there, though, so it's causing it. It could be as a result of the disease. So you can't just try to remove that microbe or add it on there to see whether it changes everything. So it takes a while, but hopefully we'll get there.
absolutely. But, this is great work that you guys are doing. And, it has answered quite a few questions in my head already. And so, let's see what the next 5 years does to, where you continue to progress your work, where we find more and more information, where we can actually make it actionable for our, community going forward. So this is a great start. I mean, a fascinating discovery, and the work that you both have done. So congratulations on that. We'll stay tuned and to learn more about how this goes from the bench to bedside, and we can actually start applying your knowledge, if not to population-wide testing, but even to people like us that could benefit. I can see myself, I can just speak for myself, but I will say that this kind of information will probably help me as a person who's invested in her own health, and I want to know more, especially I have a family history. So if there is any activity that looks abnormal, then that's something to act upon versus just sit and wait for something to happen, so thank you
I
for
understand, and I know that the sit and wait is a very frustrating thing for a lot of patients, and they rather know than do that. And so I appreciate that insight, because that's actually a great idea to focus on a population like that, and that might be very, very impactful. So,
yeah, especially if there are no direct correlation, but there is a strong link. I mean, it's not even your, it's your mom or your sister is the first degree relative. So that would be great. I'll sign up if
Thank you.
So I have asked so many questions to you. Is there anything that I have missed that, and of course I'm learning with you, so pardon my, there are certain things that I'm also just kind of opening my eyes to. So what have I missed that asking you that you would like to share with us?
I would just like to say that, a really huge thank you to you for paying attention to to this, and supporting and advocating for the cause. I think, it's people like you that make it all possible. We couldn't do it without, support from people and funding agencies, and, the Mayo Clinic Sport here, Ovarian Sport, and MOCA, Minnesota Ovarian Cancer Alliance, who really invested in a blind shot into funding this, right? And say, well, that's okay. Let's see. Why not? These are very difficult studies to fund. So, we appreciate that, as we appreciate also, we know how hard it is when we approach, patients who, have a very difficult diagnosis, either of a family member or their own, to participate in research studies, knowing that it's very unlikely that it will help them. And despite that, they enroll, and they participate in the study, and being in a very difficult situation at that point in time. And so we really appreciate that. We ask for funny things sometimes, like vaginal swabs, self-collected vaginal swabs at home. This is something we're probably going to start doing to try to monitor to see if we can actually see something of significance in particular patients. We try not to do invasive testings, so that, it can be more patient-centered, and that people can do those tests at home and just send it in. So we appreciate anybody who's willing to do those things. They can really help us develop tests that may be maybe in shelves at some point for people that want to rather know than sit and wait, as you said. We want to help those patients provide more clarity into their own individual situation. So.
Wonderful. Thank you so much for sharing all your insights. Just in closing, because I asked this question to all my episode guests, what message of overcoming would you like to share with our audience that's listening today?
Abby, can I go?
You go first.
Anything you want to say to encourage and inspire our community of survivors and overcomers, audience, followers globally?
Well, you're a survivor. You already said it. You already did it. You already overcame. And I love the name, by the way, Overcome. That's great. This is a really a terrible disease to deal with. Very frustrating. Again, seeing a lot of patients who are have done everything right in their whole life and are diagnosed with something that is so difficult to treat and overcome. But a lot of people do. And that's you. If you're talking here, that's you. And so you already overcame whatever happened to you, and we're here to really try to help with that. Tomorrow it could be me, it could be anybody, right? So we're here to try to help understand why this happened to you, I guess, and can we change that? Can we help you through that journey of preventing it would be obviously. I'd rather not have any ovarian cancer patient ever again than treat those that already have it. So prevention is always my first goal. But if we can't prevent it, we really want to make it something easier to survive, easier than what all the patients have to go through, which is just horrible. But there's a lot of researchers and clinicians invested in helping, and things that have been going a lot better, than they have been in the past. Survival rates are much better now than they used to be, and will continue to improve until, we don't have to worry so much about this disease. So we'll do our best.
Yeah, I would just say that, well, first of all, thank you for having us. Thank you for all the awareness that you create. We researchers, I feel like the best place to start as a researcher, if it's something that is personal to you. Maybe not all of us have gone through those have had family members or even ourselves go through this kind of cancers, but having patients or family members of patients who've gone through this, and this is coming from a very personal place for you, and having to advocate and create an awareness and just let people know. Until I started working with Marina and started looking at ovarian cancer, I had no clue that this was just, oh my goodness. And it's been an emotional journey, just following closely on what this disease is all about and how helpless patients feel, how helpless researchers feel, just because it's that hard. But thank you for your work. Thank you for creating the awareness. Thank you for being there for patients and advocating for patients. And we try from our end to do everything possible to reduce the number of patients. Like Marina said, prevention obviously is the best, will be the best choice. But if we cannot prevent, then how well we can do to try to make it easier for patients to recover and not have any recurrences, or however we can help. So thank you for having us.
Thank you, Abigail. That was a beautiful message. As we say at Overcome, that typically we say that 1 in 78 women get ovarian cancer during their lifetime. We want to say 0 in 78. From 1 to 0, it doesn't look like a very big deal, does it? But it actually, to your point, it is a complex and very, very difficult disease to treat. But I'm confident that we will get there from 1 to 0, someday in the future, with your work and your brilliant work, like, all the other researchers that are involved in this space. So thank you very much for sharing your knowledge and your insights with our audience today. This was a greatly fascinating conversation. We thank you for your time, and Overcomers will be back with the next episode of Connect Over Coffee very soon. Until then, you keep overcoming. Thank you and bye.